So let's say you or somebody you know has been diagnosed with heart block. Well, the good news is we have treatments for heart block. But let's back up a second. We're not even sure that treatment is needed. Let's take the situation of first-degree heart block. First-degree heart block is usually relatively benign, and oftentimes people won't even know that they have it. So usually, unless there are symptoms, most of the time, no treatment is recommended. What about second-degree heart block? Well, that's a little bit more variable. In second-degree heart block, the heart is skipping a beat, and oftentimes there are other problems with the heart that coexist. Often people with second-degree heart block are more symptomatic. While it depends on the exact type, treatment is often recommended. But what about third-degree heart block? Third-degree heart block is a very dangerous condition. It's also very unstable, and this is a very high-risk problem. Third-degree heart block is always treated. Okay, I know I said that we could treat heart block, so let's get into the specifics. How do we do it? Well, let's take situation number one. In situation number one, the person diagnosed with a heart block was an otherwise relatively healthy person who came in with an acute electrolyte abnormality. Let's say he became extremely dehydrated and his potassium and calcium are extremely skewed. Well, in this situation, you would want to correct the electrolytes. Oftentimes, with a problem like this one, fixing the underlying abnormality will fix the heart block. Similarly, if a person came in with an infection, and that infection was causing the heart block, oftentimes this will be an infection of the heart, like myocarditis. Well, you'd want to try treating the infection. Antibiotics or antivirals might help, and unless the heart was permanently damaged, the heart block will likely improve. A common situation is someone will be put on a new medicine, and one of the side effects of that new medicine is that the person developed heart block. Well, this is another easy one. That medicine needs to be changed. But more often than not, heart block is diagnosed after some sort of permanent problem. The most common culprit is a heart attack. So let's say the person does have a permanent problem. I'll use heart attack as an example, but there are lots of other situations like congenital heart disease or permanent damage from an infection. In these situations, a pacemaker is needed. Okay, what's a pacemaker? Well, a pacemaker is basically a battery attached to a computer, which is attached to wires, which are attached to the heart. Those wires deliver an electrical shock to the heart. Now, this electrical impulse is very, very tiny, but it's enough to stimulate the heart to contract. And it's the job of these wires to report back to the computer exactly when the heart needs to contract. And that computer can be programmed in lots of different ways. It can be programmed to always stimulate the heart to contract, or to only stimulate the heart when it's needed. It can also be programmed to stimulate the heart more if it senses that the body is needing it, like in the setting of exercise. Now here I've given you a little cartoon drawing of a pacemaker pack with some wire leads and a cartoon heart, but let's take a look at some real examples. Now here I'm showing you a chest x-ray of a patient that has a pacemaker. You can see some of the parts I drew in the cartoon over here. This part is called the pacer pack, and it contains the battery and the computer. You can also see there's a wire here, which is called a lead, or just a wire, either is fine. And that wire travels a long distance all the way down to here. And of course, this white structure in the middle of this patient's chest that I'm going to outline here for you is the heart. So that you can see that this wire actually goes all the way into the patient's heart. In fact, it ends in the right ventricle, and the right ventricle is about right here. Now, the way that lead got to the heart was it actually traveled from the pacer pack underneath the skin to a large vein that lives underneath your clavicle here, called your subclavian vein. Now, it keeps going in veins and bigger veins until it actually goes inside your heart. Now, that brings up another point. The pacer pack that we showed originally, you can see here it's above this patient's left chest. It actually looks like it's sitting in the patient's lung, but it's not. It's actually just underneath the skin. So, because this pacer has a single wire or a single lead, and it goes in through the venous system, ending in a single chamber, the right ventricle here, this particular pacer setup is called a single chamber transvenous pacer because it goes through the veins. Now, before we go look at another type of pacer, I'm going to draw your attention to some specific parts of this lead. You'll notice here at the end, it looks like there's a little bit that's thicker than the rest of it. Now, that thicker part of wire can actually act as the lead for a defibrillator. And many types of pacemaker setups that are put in patients will have a defibrillator component. Now, I'm also going to draw your attention to the tip. And we'll draw this magnified over here. If you were to look at this with a magnifying glass, you'd be able to see these structures. You can see the end of the wire coming in here, also called the lead, and then you'd have this little corkscrew looking bit right at the tip. Now, that's pretty much exactly what it is, and this particular type of pacemaker lead is actually screwed into the wall of the heart. The idea is that will allow it to stay put, and it won't get dislodged very easily. This is called active placement. Most people use active placement. Passive placement is also just fine. So let's move on to take a look at another type. So this one looks pretty similar. You'll notice again up here underneath the patient's skin is the pack that has the battery and it has the computer components. But this time something is a little bit different. This particular pacer has not just one, but it has two leads. They take the same course though, going in through the venous system, here under the clavicle, and then going into the larger veins down to the heart. But you'll notice one of the wires takes this funny turn, where the other goes like the last patient. Just like before, this lead at the bottom here goes into the ventricle, but this lead at the top stays in the atrium. So this particular setup is also transvenous, but it is dual chamber, because it has one tip in the atrium and one in the ventricle. This allows for pacing of both the atrium and the ventricle. Now again, one type isn't necessarily better than another. It depends on the exact situation that the person with heart block is having. Just like our other patient, this pacer pack is also located underneath the skin. Now, because these pacer packs are placed under the skin and these wires are fed through the veins into the heart, this is actually a pretty minor procedure to have done. And while it is a pretty big deal to have a pacemaker, it actually is a very safe and very effective treatment for heart block. That's not to say there can't be any complications. There certainly can, as with any treatment. But for most patients, especially with high degree heart blocks, the benefits of pacemakers far outweigh the risk.